Come in.
Okay. Hi, I'm Emily. I'm the student nurse, and I will be doing a respiratory physical assessment on you today. So, can I please just have I just need to verify your name and date of birth?
Peter Gronch, June 23rd, 1985.
Perfect. Awesome. All right. And do I have verbal consent to be able to examine you today and have you on video?
Yes.
Perfect. All right, so I'm going to, so before we get started, any shortness of breath today?
No.
Any trouble breathing?
No.
And are you a smoker?
No.
Okay, excellent. All right, so I'm gonna go ahead and observe the breath efforts. I'm just observing depth, pattern, retractions, use of accessory muscles, or tripoding. And I'm also gonna check your respiratory rate. So just breathe normally. I got a respiratory rate of 18, which is normal. And effortless, regular breathing pattern, no retractions, accessory muscle use or tripoding. All right, so I'm gonna go ahead and I'm going to inspect your posterior thorax. So I'm just gonna get behind you to do an examination. Okay. So I'm going to inspect the skin for any colors, any color changes, any lesions, or anything that seems abnormal to me. Everything looks great. So skin color matches ethnicity, no lesions present. And I also am going to check your anterior posterior ratio. I'm just going to have you lift your arm for me, please. All right. So that is, the AP ratio is 1 to 2, which is normal. Equal rise and fall in scapula, which is great. I'm going to go ahead and palpate your cervical, thoracic, and scapula. So I'm going to go ahead and just palpate, and I'm just going to have you let me know if there's any pain, any tenderness, or any masses or anything. Any pain when I'm...
No.
Perfect. So this is the cervical. I'm going to go ahead and go down to the thoracic. Any pain?
Nope.
Awesome. Okay, now I'm going to go ahead and go to the ribs. Any pain here?
No.
Okay, awesome. Okay, awesome. So I'm going to go ahead and just check your expansion. So I'm just going to have you take a deep breath for me. And one more. Perfect. So there is no tenderness or masses found. Symmetric expansion. Now I'm just going to do the tactile fremitus. So I'm just going to have you say 99 whenever you feel my hands on your body, okay?
Yes.
All right.
So. 99. 99. 99. 99.
Perfect. All right, great. So tactile fremitus equal, bilateral, which is great. Now I'm going to go ahead and percuss the posterior thorax. So I'm just listening for any abnormal sounds, and I just have to percuss your back, so just breathe normally for this. Okay. So resonance in all lung fields bilaterally, which is what we want. Now I'm going to go ahead and listen to the different lung sounds. So I'm going to go ahead and listen over the intercostal 1 and intercostal 2. And I'm listening for bronchovesicular breath sounds. So as soon as you feel my stethoscope on your body, I am just gonna have you take a deep breath in from your mouth and then breathe, and then inhale and then exhale just from your mouth. Do not breathe from your nose. Okay?
Okay.
Okay. So bronchovesicular breath sounds heard over the first and second intercostal space, vesicular in major lung fields. All right, perfect. And now I'm going to go ahead and inspect the anterior thoracic, which is going to be the front of your body. So you just come around here. Okay. So I'm going to go ahead and just inspect your anterior thorax. I'm just checking for any skin changes, any lesions, anything seen here. And skin color matches ethnicity. No lesions present. Equal rise and fall of the shoulders, which is exactly what we want to see. Now I'm going to palpate the following for any tenderness or any masses. So just let me know if you're feeling any sort of pain or anything as I'm pushing down here. Any pain?
No.
Okay. All right, I'm just going to check your ribs here. Any pain as I push?
No.
All right, awesome. All right, so skin color matches ethnicity, no lesions, no tenderness or masses, sorry. No tenderness or masses. Now I'm gonna go ahead and listen to the different lung sounds. So first I'm gonna just check your trachea. So I'm gonna have you take a deep breath in, deep breath out when I have that over your neck. I'm going to go ahead and listen over the first intercostal space for bronchovesicular breath sounds. So the intercostal, the first. All right, take a deep breath for me. 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 Let me get over by your ribs here, sorry. Take a deep breath for me. Okay. Okay. All right. So no stridor on the trachea, which is really great. Bronchovesicular breath sounds heard over the first and intercostal spaces, vesicular and major all lung fields. And that is the end of our exam.